Good evening, everybody. Thank you for joining us tonight and welcome to tonight's Breast Cancer Now Facebook Live. And tonight's session is going to be about exercise and breast cancer. I'm really excited to be joined tonight by Caroline Tweedy, who is a specialist breast care nurse from Gateshead NHS Trust. And I will introduce Caroline properly in just one moment. Just to quickly go through a little bit of housekeeping to start with. So we have had some fantastic questions in advance of this session, but we will be able to answer your questions live, hopefully. So if you do have questions, please do pop them in the chat box below, and we're going to answer as many as we can as we go through the session tonight. Anything that we're not able to answer live, I will type replies for you over the next few days in the comments. So even if we don't manage to get to your comments and your questions as we go through the session, you will get an answer over the next few days. The other thing is, if anything triggers questions for you that you'd like to talk to one of our nurses about, or if you have any other questions around breast cancer or breast health and you would like to talk to one of our nurses, our helpline will be open again from 9 a.m. tomorrow. We're open 9 till 4 Monday to Friday and 9 to 1 on a Saturday. And you can talk to our nurses or you can email us through our Ask Our Nurse service. The links to all of that is going to be in the chat below. But our helpline number is 0808 800 6000. So if you do have any questions, anything that you want to talk through in more detail, please do give us a call again from tomorrow morning. There's going to be another link in the chat below, which is to a survey, which is all about how you have found the Facebook Lives, anything you'd like us to cover, any comments or questions that you've got, you can fill in that survey for us, and it just helps us to improve these sessions for you. So if you've got a few seconds at the end of the session, it'd be absolutely brilliant if you can fill that in for us. So that is my preamble. So with no further ado, I would like to introduce Caroline into the conversation. Hello, Caroline. Thank you so much for joining us tonight. We're really excited to have you.
Oh, thanks, Cassie. Thanks for having us.
What would be fantastic is if you could just sort of introduce yourself to start with, let us know a bit about who you are and your role and your sort of interest in this area.
Thanks again. Yeah, I've been a clinical nurse specialist in breast cancer for about 17 years now. And within that, I specialise in exercise and recovering cancer, which has always been a massive interest for me. But I think for me, it really kind of came to a head in 2018, where that interest really crossed into the role as a cancer nurse. I was really inspired by a professor, John Saxon, at a conference. So he was doing a conference about the effects of physical exercise on breast cancer. And John Saxton is like the godfather of all of these like clinical research trials. And he demonstrated all of these meta-analysis research, which is where lots of researchers put together, and it consisted of hundreds of women in these trials. And he was saying that, getting women to engage in physical activity after breast cancer, we can see something like 20 to 30% reduction on average of recurrence. We're just getting people to engage of 30 to 45 minutes of moderate activity 5 times a week. So that's the equivalent of like a brisk walk, and we were just in awe of this information that was coming in. So even just, 2018, that platform of physical activity was still a little bit shaky, but this was coming through and it was just incredible. But then obviously you give the other side of it, and what we have to appreciate of what women are going through after breast cancer is, it's not so easy to do that level of exercise. They've got arthralgia and fatigue, hot flushes, body image issues. There's also the weight gain, which is so common as well. On average, a woman is putting on, something is 1.5 stone of weight within that first year of diagnosis. So at the conference, he was looking at recruiting a dietitian and a lifestyle advisor for this new randomized controlled trial called The New Day, which was the North of England women's diet and activity after breast cancer.
Fantastic.
So I had a background as a fitness instructor, and I've got this terrible problem with FOMO, fear of missing out. And I was like, I need to be in this. So, I volunteered, and first of all, I had to train as a cancer rehabilitation practitioner. I went off and trained as a personal trainer and an exercise referrer, and it took a little while to do all of that. But eventually in 2021, we went live with this new trial, and it was delayed because of COVID, but it was essentially a 6-month intervention looking at improving physical activity and diet for women who had a BMI, high BMI. And we had a group of women from Durham, Gateshead and Sheffield. And every 2 hours, every 2 weeks, for 3 months, and then it was monthly after that for 3 months. It was a 6 months. What we did was we met with these women over Zoom and we talked about the principles of diet and physical activity, so they could apply their own methods to how they would get fitter and help them to lose weight. And, we helped them to get the confidence to pick up weights and engage in strength training and functional compound movements and exercises. And we explored all the pseudoscience around diet that's constantly filtered through on social media. And it was just an incredible 6 months. And I learned so much from these women that, like I say, it was the most valuable thing I've ever done in my professional career. But when the trial came, it was just that the results of it was fabulous. They'd all lost weight. But for me, again, it was the quality of life bit that really shone through. What healthy lifestyle can do to somebody after a cancer diagnosis, and giving them that confidence to do it. Their body image improved, they were having sex again, the menopausal side effects were a little bit well controlled, and they were sleeping. And it was incredibly well designed by the research team. They had spent months and years, interviewing women who'd had breast cancer to really find out what does it feel like. And this was just a preliminary trial, but hopefully later this year, Professor Saxon and his team are looking at getting a really large trial together for the north of England, looking at recruiting about 300 and 400 women. So hopefully we'll get more and more women into this. But what came out of that trial was women were saying, this was fantastic at the end, but where were you at the beginning?
Absolutely.
And that's where my interest came in with the prehabilitation bit.
Absolutely. And you've covered so much in that we're going to come back to later, particularly around sort of confidence and confidence in that individualized, personalized advice for people, and that how this journey is so different for everybody, and being able to get that specific information that's relatable for people, it can be quite tricky. And I know that's some of the stuff that we're going to cover as we go through. But to start, as you say, sort of at the beginning, so we have known sort of as breast care nurses, sort of post-surgery, post-treatment, we put in place a lot of things for people, but that prehabilitation stage, that sort of getting to people at the beginning, as you've said, is an area where people are really receptive and really wanting that advice, really wanting to know what they can do to help themselves. And it potentially is not where we're putting that advice in place. And it sounds like that's one of the areas that you're looking at.
Yeah. And I mean, you're going on the biggest journey of your life. When people are diagnosed, their life implodes. And, I think the least we can do is give them a roadmap of what's going to happen, explain why we give chemotherapy, why we give radiotherapy. But also alongside that is how do you keep yourself well during that time? And that's what prehabilitation is. It's getting you, if you were going off to do a marathon, you would want some intervention, you would want training, you would want to understand, how far you're going and how fast you had to go. And that's what prehabilitation is. It's just preparing you for that journey.
Brilliant. That's absolutely fantastic. And that's so important for people, isn't it, to have that empowerment for something that they can do to keep themselves well during treatment.
Yeah.
That preparation is really important for people.
Yeah, and there's really, for a lot of the time, this prehabilitation was very based on the big surgical cancers like bowel and a lot of the gynae oncology. But now, we're seeing that even if a patient is being diagnosed today and their surgery, might be in a month's time, there's still so much we can do, stopping
Absolutely.
smoking and getting to walk a little bit more and, getting your nutrition right before that surgery or maybe that chemotherapy starting.
Brilliant. Fantastic. And actually, that kind of leads quite nicely into sort of the next questions that we were going to talk about. Because a lot of people struggle to understand sort of what is safe, what they can do during treatment. And a lot of people sort of feel, well, I have to stop everything while I'm having treatment, and don't really know what they can do and what's safe to do. And we've had a question in that relates to this from Vivian, who's asking about getting back into exercise after reconstruction surgery. And there's also a question that's come into the comments about sort of exercise that can be done when you've got a seroma, sort of what's safe to do. So I wonder if you want to talk a little bit about sort of surgery side of things.
Yeah. So obviously safety is paramount, always check with your health professional, especially when you've had, something like a DEP flap where we're taking muscle, from the abdomen and moving it over to the chest area there. There's always that worry of a hernia. But again, just checking as long as they're ready. Obviously, in the first few weeks of something like a reconstruction, it's getting that confidence back again. A lot of the time it's the circulatory exercises, so it's rotating the shoulders, getting the neck moving again, and posture as well. What we tend to find is after breast surgery, people want to kind of defend that area, which is really
Yeah, they feel
natural.
vulnerable.
Yeah, and what tends to happen is this kind of posture, which I see a lot of, cause a lot of curvature with the spine, see a little bit kyphosis, and that the scar areas become so tight, and your oxygen levels as well, because you're not able to breathe efficiently as what you did before the surgery. So those first couple of weeks, really think about that posture. And again, after reconstruction, so it's about getting those shoulders into the back. Think of two envelopes in the back and getting the shoulders back there, opening up the chest area there, and be really mindful about that breathing and having that confidence to take nice deep breaths in as well. We would tend to say that, again, on the advice of your physio, they'll, for something like the abdominal surgery, some of the flap surgery, they will give you some exercises with regards to the abdomen and getting that
Yeah.
stronger as well. But we kind of can start becoming much more strenuous in the exercise up to about week 6 to 12. On discharge, they would recommend that just a small couple of walks throughout the day, and I'm talking, maybe 6 minutes, go out in the morning, then try again in the afternoon, and, all the time you're risk assessing. How do you feel? Do you feel dizzy? Do you feel
Yeah.
breathless? Then maybe that's time when that's not the best time to do it. We can start going back to the gym and start looking at a little bit more resistance training about week 8 to 10, if everything's healing and everything's well. So again, if you've previously been very fit and you've been always into the gym as well,
Mm.
again, go back to the beginning. We're kind of, if you've ever had an injury, you've got to leave your ego at the front door and start from the beginning. And it's all about form, getting the posture right, making sure that you're doing those exercises correctly, and when there's things like implants, those implants have got to take time to
Yeah.
embed, things like chest press, you really don't want to be running into that. Get yourself a broom first. So you want to, if you're really into doing sort of weightlifting or weight resistant exercise, get the form right first before you start introducing any form of weights. And again, you have a look at your rate of perceived exertion. You want to keep it light when you're first getting back to it, and then gradually go back into it at that point as well.
And do you say, I mean, obviously it's different for people that are used to exercise and people that haven't exercised before. Is there sort of an element of very much sort of listening to your body, sort of trusting how you're feeling, sort of pacing it differently, sort of depending on what your starting point is?
Yeah. Yeah, I mean, especially, we do encourage things like exercise during chemotherapy as well, which again, once upon a time when I first came to the job, it was wrapping people up in cotton wool and telling them
Absolutely.
to rest, and we know now that we need to get lots of rest. That's really important as well, but balance that out with movement as well. And it doesn't have to be in the gym. We talk a lot about in cancer rehab neat activity.
Yeah.
So that's about just regular movement. It's non-exercise thermogenesis, where things like housework, doing some hoovering, some gardening, getting the shopping in, all of that is really, really important. But again, you're doing that risk assessment. How do you feel? The people will say, well, can I go to the gym when I'm on chemotherapy? How do you feel that day? Do you have that energy to do it? Or you maybe want to wait until it's off peak and it's not as busy, or
Absolutely.
maybe, use some of the outdoor activities as well. So again, it's very prescribing exercise. It can be very personal. depending on what your exercise was like before you were diagnosed, or, you know, and how fit you are during these treatments as well. But movement is so, you know, every 30 minutes, we should be looking at least standing up, you know, and just doing, you know, go and make a cup of tea or making a drink or using the stairs, you know, so it's just trying to avoid for sitting for long periods of time.
Absolutely. I think that applies to all of us. That's sort of, as well as post-op, that's advice that everybody, all of us can be taking. And you mentioned there as well about sort of chemotherapy and treatment as well. And I know we've had some questions in around that. And obviously, after people have had surgery, they'll be in recovery, and then they will quite quickly sometimes go into having chemotherapy. And also, people with secondary breast cancer who are on chemotherapy treatment or other treatment sort of long term may well be looking at how to incorporate this into their sort of day-to-day lives. We do know that side effects like fatigue can be really difficult for people. And I believe there's a role in exercise in managing that side of things as well. So do you want to talk a little bit about sort of the systemic treatments and chemotherapy and how exercise can be beneficial in that setting?
Yeah, so during chemotherapy, again, you've got to get those energy levels right as well. And there's a lot of rest involved in that because the body has to do so much. So what we would advocate during this time is, we call it activity snacking.
Yeah.
So instead of thinking, oh, you know, I've got to do 30 minutes of exercise, which is sometimes not achievable during these treatments, and especially when you're dealing with fatigue. So, you know, when we exercise, within minutes of moving, we start activating muscles. And when you activate muscles, you start to circulate the white blood cells. So these are like your T cells and your NK, your natural killer cells. This is like your frontline immune system, and they're the SES that fights, you know, infections and diseases. So when you contract muscles, you're increasing this army and volume of these kind of cells that travel around the body, and they travel at a much higher velocity and volume as well. So that's why exercise during these treatments is so important. It's actually topping up the immune system when it's kind of on burnout with the chemotherapy. So the more often we do these little snacking exercises, such as, you know, you can get a weight resistance band, something like this, you know, and just do some chest exercises, some shoulder exercises like that, even just doing some contractions, little and often. What that does is that it keeps that immune effect, so that SES army of cells will keep elevated for hours at a time after that small bout of exercises. And it's not too taxing. It's not going to have a huge effect on the body, but it's going to have a huge effect on your immune system as well. So it's a bit like an internal housekeeper in your body, just constantly mopping up all of these sort of oxidative stress and inflammation that's going around in your body as well. So keep it small, keep it frequent, but again, listen to your body as well. So, you know, I've recently had a 75-year-old lady who'd been newly diagnosed with breast cancer. She'd had surgery, and, you know, during every appointment, she was alone. She'd lost her husband just prior to a diagnosis of dementia. And, you know, she'd lost a lot of her confidence just going outside and doing exercise. And she had previously been really fit, you know, and I just said, right, well, every day what I would prescribe for you is 6 minutes of walking, but I
Yeah.
don't want you doing any more than that. You can do it as often as you like, but 6 minutes, you know, and just that 6 minutes, she was saying, you know, and that was her maintenance on chemotherapy. What I would say is that you're not looking at progressing your
Yeah.
fitness, you're looking at maintaining your fitness and having these little benchmarks of, you know, where before treatment, how far can I go in 6 minutes, will give you something to kind of think, wait, I need to kind of keep to that, around that bit area as well. So that's what she did throughout her treatment. She kept at these little 6 minutes of exercise, which was three lampposts down the street that she managed to get to. She did say one of her neighbours had thought she had some really strange relationship with that particular lamppost, but she explained what she was doing. She was really interested, and she wanted to know how
That
far
was
she
her
could go.
goal, and she was
It
getting
was,
there.
yeah. So
That's
it's about
fantastic.
making it achievable,
Yeah.
you know, and that even if you are waiting for surgery or chemotherapy, it's not about waiting, it's about preparing.
Yeah. And that's so important what you've said there about sort of those expectations. And so many people say to us that sort of, if I can't manage 30 minutes in the gym, what's the point? And they feel really disheartened that they're not able to do that kind of volume that they were doing before, or the intensity that they were doing before. But actually sort of focusing on those small wins and hearing about the physical side of that, as well as, the mental health side is so important, particularly with sort of managing fatigue. And we quite often will say to people, getting out for a short walk, getting that bit of gentle exercise is really going to be good for boosting your mood, for improving your fatigue levels. But hearing from you the physical benefit side of it as well just shows there's so many different areas where this can make such a difference for people.
Oh, totally, totally. It's like an instant tablet if once you elevate those bloods, and you activate those muscles straight away, those dopamine levels, there's endorphins, which often when you're sitting for long periods of time, you don't get that. And the
Yeah.
less you get, that it's one of the reasons why we want to move less, but it is so important to keep moving.
And while we're talking about sort of side effects of treatments as well, I know we want to talk a little bit about side effects such as joint pain. So a lot of people will have medications like letrozole as part of their treatment that can cause lots of joint aches and pains, sort of muscle pains, muscle weakness, and exercise can really help manage those kind of side effects as well.
Yeah, I mean, that's why what tends to happen as well, because of that lack of estrogen that many people find during taking things like the endocrine therapy, such as tamoxifen and arimidex, is that it can have a huge effect on things like collagen and the connective tissues, which happens in any way as we age. But that connective tissue is really important in human movement. It's part of our ligaments and our tendons, and it's basically a framework that supports and connects your body. But it needs to stay hydrated. Which you need to do via hydration, such as water, and making sure that you're drinking plenty during treatments and during exercise. But if you think about this connective tissue, like the hinges of a door, if you don't keep it hydrated, it makes it very difficult to move. And we only
Mm.
we keep it hydrated by moving and keeping, when you think on a morning, getting out of bed, especially a lot of my ladies who are taking these tablets will say on a morning, it's
Yeah.
horrendous getting out of bed. And that connective tissue has it can be like gel and thick, and it makes mobility quite hard. But when we're warm and we're moving, it kind of melts away and it becomes much more fluid. And that's why we talk about warming up before we do exercises, because of those connective tissues, and it reduces things like injury. But the more we move, the more that connective tissue becomes looser, the easier and to move around. So again, it's the little things that can often make a big difference. So, a muscle mass as well. When we're on chemotherapy, the muscle mass is depleted again. So when you're coming on to using tablets like the endocrine therapy, it makes it even worse because it exacerbates a lot of
Okay.
those aches and pains. So maintaining muscle mass on chemotherapy is really important to get you over that finish line with the endocrine therapy as well.
And I know, as we've said before, anyone thinking about exercise needs to speak to their treatment teams to find out what's right for them. But is there any sort of particular type of exercise that you would suggest people speak to their teams about for that?
Yeah, I mean, obviously reconstruction and a lot of these big, large abdominal flaps or back flaps, you certainly have to be signed off to do any sort of
Yeah,
exercise like that. But the written rule is that you get the form correct.
right.
And that even, for somebody like me who regularly exercises, I don't do a lot of running now. So if someone told me to go out and do a 4 mile run tomorrow, I know that there's a high risk of injury there because I haven't worked up to 4 miles. So what we have to do is start off really slowly, get the form right, get the posture right, make sure that you're hydrated and listen to your body. So if you are, it's January, we all want to go hell for leather when it comes to exercise. What I would say is start off really small, because if you go in, do an hour's class where you've never done an hour's class before, you're going to get the DOMS, which is delayed onset of muscle soreness. Now, this is, and it's worrying when you're feeling those pains, especially when you've had cancer, because you're thinking,
Yeah.
is that normal? Is that to do with the exercise that I've done? It can put people off. You can lose confidence with that exercise. So again, that's why, get the form right. Start off really small. Those 6 minute walks. How do you feel? Was it too much? Scale it back. If it was absolutely fine, and suddenly you're asking yourself, for that rate of perceived exertion, what was it? Was it manageable? Was I able to hold a conversation? And it's the same if you're doing any sort of resistant exercises. So again, resistant exercises, you can use tins of beans, and what you want to do is constantly evaluate how does your body cope with that weight? If you're finding that you're doing, 12 reps and you're not even breaking out in a sweat, there's no challenge there. Is move it up to something where it's a little bit higher, and then, you're doing a risk assessment after 12 times. How does that feel? Actually, that's struggling a little bit. You want to find, we call it the Goldilocks moments where it just feels just right. That's what you're looking for. Any sort of searing pain, anything like that's causing you dizziness, which doesn't feel right, that's your red flag to see that this is not what I should be doing. We need to stretch, and you need to feel that discomfort, because progress is uncomfortable, but it's understanding the different pains. One where, you put yourself at risk, and others where, no, this is actually just the normal kind of feeling that you'll get when you progress through these exercises.
That's fantastic. And we have had a few questions in of sort of quite specific about types of exercises for the back or for seromas. And I think obviously for those kind of questions, people need to be speaking to their teams and sort of accessing some support. We do, through Breast Cancer Now, have our Moving Forward programme for people who've had primary breast cancer, and there's some sessions in there around diet and exercise and lifestyle. Through hospital teams, people should be able to get access to physiotherapists and cancer sort of rehab programs in a lot of places. Is that sort of the best avenues for people to go through to get that kind of specific advice?
Yeah, I mean, you have some incredible advice on there as well. The one thing that I have found with things like secondary cancer, though, is that the guidance is really weak from a national point of view as well. And I'm hoping that, people like Professor Saxton and, will go out and have a look specifically about, the challenges that people have exercising with secondary breast cancer. And it's challenging for people like clinicians and people working with cancer when there is no guidance of what we can tell patients they can and can't do with secondary cancer as well. So that's something that we need to move on. And I know people like yourself and working in secondary cancer are trying to move on that agenda. So fingers crossed we'll see a lot more of that in the future.
Very much around the clinicians being empowered to have that confidence to advise people well, as well as people having the confidence to actually get up and get moving. And actually, I know we wanted to talk a bit about secondary breast cancer, and we've had a question in from Karen, who has said, as somebody with secondary breast cancer in her spine, can any exercise make tumours worse? And I think that is one of the worries that people come to us with in clinic is doing exercise going to make things worse for me? Am I going to make my symptoms worse? Am I going to make my pain worse? And it can be really, really difficult for people in clinic to give sort of very specific advice for people. So I wonder if you sort of feel comfortable, if you want to talk a bit more about people with secondary breast cancer and exercise.
Yeah, and like I say, the bone metastases, Macmillan is doing some work with regards to guidance, regards to that as well. But exercise, they've just there's just been a really large seminar where they talked about bone metastases and exercise, and they've seen a huge increase in energy levels when you exercise. Again, it's about maintaining muscle mass, because a lot of people with secondary breast cancer are kind of going from one regime to the next regime. So you've got to have that resilience to do that. And the only way you can do that is by building up muscle. But again, it's understanding that there's going to be some areas of the body that we want to make sure that we don't make worse. So, in the spine, things you've got to really, what I would be doing is focusing on strengthening the core around the spine, so that you're much, when you're doing things, you haven't got that kind of worry that you're going to make something different. So sort of, flexing at the spine is something that maybe we would want to avoid. But again, using things like the resistance bands like that, you can use to open and expand into their muscles as well. But things again, when you're lifting weights above your head as well, and you're using things like a Swiss ball where you're using it to balance on as well, you're using your actual core to keep you within those limits of doing that as well. So people think, well, to have a strong core, you've got to do lots of sit-ups, but actually there's lots of exercises that you're using working your core that isn't going to put your back at danger as well. So somebody with spinal mets, like I say, you want to really work on the core, and finding somebody maybe in Pilates or yoga who has experience with that as well, and watching the form, watching that you're doing something properly and that you're not you're putting yourself at risk as well. Stationary bikes are amazing as well. They're going to use, some of your really large muscles in the tops of your legs as well, which is generally one of the first places where you start to lose muscle when you're on these treatments. And they're the ones, if you're losing muscle there, you can imagine trying to stand up without those muscles. It takes a lot more energy, which again feeds that fatigue as well. So, stationary bikes. And what we've also found as well is that we've got a new trial that's going on at Gateshead Health. We've got this fabulous PhD student called Rosie Red, and she's looking at exercising the day before taxane chemotherapies. And what they're trying to look at is actually when you exercise before that taxane's given, it can help reduce neuropathy in the fingers, in the fingers and the feet, and it can be really, really debilitating as well. So again, it kind of distributes the toxicities of that treatment as well. So I think there's a lot we can take from that as well, and it's certainly starting to get the green light that it is safe to do when you're on these sort of treatments.
And those are the sort of side effects actually we hear from people can be ongoing for quite some time. The peripheral neuropathy, fatigue, those kind of things can be sort of long-term complications for people. So anything that can help manage and improve those symptoms will have a huge impact on quality of life for people. And I think that's a really sort of important point that comes up from what you were saying around sort of finding things that people can do that can be beneficial, but also things that people enjoy as well, I'd imagine would be really important. Sort of particularly if you're on treatment long term, and sort of any kind of movement that you can get joy from within the realms of it being safe can have a huge impact on quality of life.
Walking is absolutely fabulous, and it can mobilize more joints than running.
Yeah.
So again, people with bone metastases or knee problems, if you're suffering with arthralgia, are very worried about, what they can and can't do as well. And you can still introduce a lot of weight resistant exercises in walking. You've just got to be a bit more imaginative. I use things like weighted vests as well. It's a bit of a running joke that for my birthday, I increase the weight in in these vests that I wear. I started off when I first started with a 5 kilogram weight, but I've kind of just keep moving and moving. I don't have a huge amount of time to go running and do a huge amount in the gym. So what I try and do is maximize the time where I'm doing something. So if I've only got time to do a 10-minute walk, I want to make the most of that walk. So and you don't have to go out and buy one of these weighted vests. Sometimes just putting on a really well fitted backpack and putting a small weight in, tin of beans, or whatever, and go and find yourself a hill where there's a little bit of a gradient, and time yourself, and get yourself up there. And how do you feel at the top of that? Could you do a little bit more? Go back down that hill. If you can do a little bit more, try it again. And just that extra little bit of weight. The Navy and the Marines did a lot of research in adding this sort of weight on, and the difference in your pulmonary in the way that you breathe and your blood pressure is massively effective positively just by adding that little bit of extra weight on when you're doing these sort of exercises as well. So again, it's just a little tip there that I find that, and it's, like you say, it's easy to do, and it's just adding that weight resistance, which is really, really important after something like chemotherapies and some of the treatments that we do. We want to rebuild those muscles.
And there are groups of people are sort of listening, thinking this all sounds fantastic, but I just don't know how to get started, how to get myself sort of into exercising. There are some fantastic support sort of groups out there. So things like 5K Your Way, who are linked into the park run, where people will come together who have been affected by cancers and walk the park run together, or walk part of it, or run it if they're able to. And they form a bit of a community to come out and support each other to get back into being active. And sometimes finding that community, finding that support can help people to sort of manage that first step into getting back to doing some exercise and feeling supported to be able to be active.
Totally. Totally. I mean, it's about what we found in the New Day trial is that we had to make people accountable.
Yeah,
So this group of women that we'd met on Zoom, they actually met each other face to face, and they'd set up. They were going to a yoga class together and Pilates class, and there's something about having to be somewhere.
yeah,
It's easy to put things off when you've been to work or you've had a bit of a flat day. But when you have to go somewhere or somebody's depending on you to be there, it can increase the rate of sticking to that exercise as well. But I think you mentioned it before. I think the most important thing is find that Goldilocks zone, something that you really enjoy
yeah,
doing.
absolutely.
That's what's going to keep you going.
Fantastic. That's really, really helpful for people. And I know it's January, and we spoke earlier about sort of goal setting and sort of being January this time of year. A lot of people are looking at sort of new year, new goals, and it can be really inspiring for people, but it can also put a lot of pressure on people to feel like they have to set these big goals. But actually, sort of like you say, those small wins, sort of not putting that pressure on you. The exercise snacking, I think, is a fantastic idea of just finding those little bits of movement throughout the day. Sort of giving yourself goals in that way, I'd imagine, can be helpful for people as they go through treatment and diagnosis.
Yeah, and what is it, what is it that you want to be? What do you want to do? And find the why and find the
Yeah,
how. You can't, one without the other just doesn't work. And like I say, before you go to bed, have a little journal. What do you want to maybe achieve tomorrow? And it could be just something like clean the, the, the Tupperware cupboard, which is
yeah,
obvious, just sometimes it's the small things that has a domino effect. Think, oh, well, I've achieved that. I might achieve the downstairs hoovering, and we've got to stop looking at exercises where you go out for a run, you go out for a walk. There's so much just moving within the house and just doing these little bits, especially when you're dealing with fatigue and you haven't got
yeah,
that kind of will to do it. And what I try and do is, the next day when I wake up in the morning, it's very, nobody I know, that alarm goes off and you jump out of bed thinking, great, I can't wait to go and exercise. It just,
yeah,
the body doesn't work that way. So set yourself up, if that's really what you want to achieve, then set it up the night before, lay out the clothes, lay out the trainers, write down what it is that you want to do, and how you're going to do it as well. And keep a little diary. Journaling will massively increase the chances if you stick on whatever to that New Year's resolution
yeah,
is, it does make it
absolutely.
that little bit more accountable.
And it's about making it part of a lifestyle rather than just sort of a short-term thing. And I think that advice is sort of applicable not just to exercise but to lifestyle changes and so many areas, and journaling for a mental health benefit as well for people going through treatment and in everyday life as well. I know it has been recommended as something that's really helpful. That kind of process of putting things down on paper to cement them into your mind is something that can be really, really beneficial for people.
It is, and lifestyle isn't linear.
Yeah,
You're going to have times where you're going on holiday and, you want to drink and eat and just enjoy and be with the family.
yeah,
But,
absolutely.
and then you come back from it and it's like, okay, I understand the principles of healthy living. I'll just start going back to what I want to do again. So it's just getting that balance of doing that, but also living your life and getting the most out of life. And the great thing about having a great lifestyle is that those limitations that sometimes cancers and treatments do, it can start pushing them out and you can start pushing the boundaries. Sorry, I think I just went off there.
It's okay. No, you're
You
still
know,
with us.
I'm sorry, that was like real panic. So yeah, it's lifestyle. I've never seen anybody who has introduced a positive lifestyle into their life and not had a good experience from it.
Yeah.
And everybody will have their own definition of what that will be.
And something you've just said, I think, is really, really important for people going through a breast cancer journey, whether it's primary breast cancer or secondary breast cancer, is that this journey isn't linear. Is that a
No,
lot of people see sort of a trajectory and think it's going to be a straight line, but actually there's going to be good days, there's going to be bad days, and a win on one day is going to be very different to a win on another day. Sometimes just getting out of bed for a few minutes might be a win. Other days you might feel able to sort of take on the world, and actually accepting that it's not linear and every day is going to be different, I think is such a huge part of the acceptance of this kind of journey.
oh, so right, Cassie. Like I say, it's doing what you can on that
Yeah,
particular day. And if you have a good day, that's great, that's fantastic. And each day is going to bring its own challenges, and just people have these worries and anxieties, but they're legitimate and it's okay to have
Absolutely.
them,
Yeah.
but hopefully with the support that you guys give and, we trying to do as best we can, then we can keep helping and supporting those people who are maybe struggling.
Fantastic. And one of the things that we haven't mentioned so far is obviously the Gateshead podcast that you guys run. And there's lots of advice and tips from different healthcare professionals around sort of diet and lifestyle and exercise, but also lots of different aspects of breast cancer journeys. So we'll put the link for that below, because that's somewhere that people can go to if they want a bit more in-depth information and discussion around these topics. And as I say, our Moving Forward programme as well has some advice, and we've got some new exercise information coming out on the website soon that's recently been updated. So there's lots of avenues that people can go to if they're thinking, actually, I want a bit more personalised individual sort of support with this. Just give us a call or access some of the links that we're going to put down below, and hopefully you'll be able to be guided to find the advice that's right for you at that time.
Yeah, I also run a very small private virtual clinic as well, and if anybody wanted any sort of wanted to get involved with that, they can contact me on Caroline at the cancer recoveryclinic.com as well.
Fantastic.
So we're also going to be doing a six week program with Future Dreams starting on the 28th of February at 7:30. So if anybody wants to be part of that, they can get in contact with the team there as well.
Fantastic. Is that going to be virtual? Is that something people will
All
attend
going to be virtual.
Perfect. So it's accessible across the country. That's fantastic. I think we've covered most of the questions that have come in, and I know we are running short on time, and that feels like a really good place to round up. But there was one question that I know had come in that we haven't addressed around sort of heart rate and how far you can push your heart rate when you're sort of going through recovery and treatment. And I wondered if you just want to sort of very quickly sort of go over that one before we sign off, and then I think we've actually covered most of the questions that we've had in.
Yeah, so I mean, like I say, it's we all wear these wear smartwatches that have heart rates on, but heart rate normal, anything between sort of 60 and 100. Some people who are extremely fit will have normal, very low heart rates. The British Heart Foundation have got a really good tool that you can use where you can put your age in, and it'll tell you what your heart rate is. Your maximum heart rate, if you're doing some exercises, anything you want to be working between 50 and 85% of that. Do take some of these smartwatches with a pinch of salt as well.
Yeah.
I was blowing out the back end of the day exercise, and it said my heart rate was 55. I can assure you it was not 55. So it's that internal risk assessment. Yeah. How do you feel? Do you
Trust
feel
your
dizzy?
body and how you're feeling.
And your heart rate, the more dehydrated you are, the faster the heart's going to be. So always when you're exercising, make sure that you have water very close by as well.
Fantastic. That's absolutely brilliant, Caroline. I think we've got through most of the questions. If there's anything that's come in live that we haven't managed to address, as I say, we'll write some answers in the comments over the next few days for people. But I believe we are just sort of running out of time. So, Caroline, I do wonder if you've got any sort of final thoughts, anything you've not managed to cover that you would like to say to the people watching.
Just thank you for having us. Like I say, everyone will have their own why, everyone will have their own how, but tonight, get yourself a little journal, write it down. What is it that you want to achieve? And it can be the smallest of small, but it's just something that you feel, or maybe even think in a year's time, where do you want to be? How do you want to do it? But your world's your oyster. And like I say, there's plenty of us around to support if you've got any sort of queries.
And I think that's the big thing, isn't it? Don't be afraid to ask and reach out for support. And, if you're worried about what is safe and what isn't safe, chat to your teams, ask to speak to a physiotherapist. And there's lots of avenues you can go through to get that advice. So please do just reach out to people and ask. Don't be afraid to.
Yeah.
Perfect. Thank you so much, Caroline.
No
So
problem.
we will finish there. Just to say to everybody again, thank you so much for posting your questions and for tuning in and listening. We will go through and write some more answers over the next few days. And as I say, anything that you want to ask that we've not covered or anything you didn't feel comfortable to ask, please do use our helpline as of tomorrow when we're open again from 9 o'clock. And to remind you, the number for that is 0808 800 6000, or we've got the email Ask Our Nurse service that you can always access. A reminder again that there is a survey in the link below that you can fill in to give suggestions for these sessions, and also the details for the helpline and the links that Caroline has suggested. And we'll put the link for the podcast as well in the comments below. So all the things that we've suggested tonight, you should be able to access through the comments. Just a little plug for our next Facebook Live, which is going to be on Monday. That is going to be around radiotherapy, and that's going to be with Rad Chat, who are two radiotherapists who are extremely knowledgeable, and we're really excited to have them on. So Ask has gone out for questions for that one, and we'll be chatting to them and going through your questions on Monday. But for tonight, that is it. Thank you so much for listening, and thank you, Caroline, for giving up your time to join us. It's been absolutely brilliant, and I'm sure people will have lots to take away from this session. So thank you.
Lovely. Oh, thanks very much, Cassie. You take
You're
care.
welcome. Good
Thank
evening,
you.
everyone.
Bye-bye.